It's amazing, isn't it? We hear all the time about the incredible leaps forward in medicine, like new drugs and groundbreaking technologies. But what about the people? The actual human beings on the front lines actually delivering that care. What happens when they are struggling?
Well, today we're diving deep into a really crucial situation that's unfolding in India. It's a major shortage of healthcare professionals, and we're going to explore how this shortage is directly impacting the quality of care that you or someone you love might receive.
Yeah, that's exactly right. And to get to the bottom of this, we've gathered a bunch of really insightful sources.
Oh,
We're
cool.
looking at a recent report that was put out by the National Skill Development Corporation. We're also going to be digging into a super in-depth academic review. It was published in BMC Public Health, and it really dissects this issue, like from all angles.
Sounds thorough. Yeah, and we're going to be pulling in information from organizations like NABH and Superior Medic Consultancy as well. We're going to explore things like the whole permanent versus temporary staffing situation, and we'll look at the massive role of continuing education for these folks.
Uh-huh.
And we can't forget about the absolute necessity of having a really strong medical training system in India.
Yeah, makes sense.
Oh, and there's this really interesting review that just highlights how directly nurse staffing levels actually affect how patients do, their outcomes.
So, for everyone listening today, our mission is to move beyond those surface level headlines. We're going to try to really grasp what's at the core of this challenge.
Right.
We'll be looking at what's causing these shortages, and then we're going to jump into some of the potential solutions that are being discussed and in some cases even being implemented, as we speak.
Absolutely.
Let's kick things off by looking at how big the demand for healthcare professionals in India really is. Like, how many people are we talking about?
Well, if you look at what the NSDC report says, the demand is set to skyrocket, like really significantly.
Okay.
They are predicting a 100% increase in the need for healthcare professionals by 2030.
Whoa, 100%. That's a doubling, basically.
It is, yeah.
Yeah.
And that's just in a few short years.
Okay, so we're not talking about just a small bump here. This is a massive change coming. So what's driving this? Why is there such a huge need all of a sudden?
Well, a bunch of different factors are all kind of coming together at the same time.
Yeah.
The NSDC report actually emphasizes how much non-communicable diseases are growing as a problem.
What does that mean, non-communicable?
Oh, yeah, I should have clarified that. It means things like diabetes, heart disease, the kind of conditions that require continuous care over a long period of time.
Oh, right. I get it.
And, of course, we've got an aging population, and it's natural that as people age, they'll need more health care, right?
Yeah.
And then you got just basic population growth in general. That's always a factor. And then there's the whole AI thing. Artificial intelligence is becoming more integrated into healthcare, which is super promising. But, initially it requires a lot of skilled people to actually implement it and manage it.
Okay.
And the health insurance market has been expanding rapidly, meaning more people have access to care. And that, of course, drives up demand.
Makes sense.
And then the government's got initiatives like Ayushman Bharat, which aim to make sure more people can get health care. So what we're seeing is India's success in, living longer, having more access to care. And even in terms of technology, it's ironically putting immense pressure on the people providing that care.
So basically, progress in some areas is causing a big problem in others.
Pretty much, yeah.
And it's not just about needing more doctors and nurses to treat people. You've also got the healthcare infrastructure itself growing, like all the buildings and equipment.
Exactly right.
That takes people power, too.
It absolutely does. The hospital market in India is currently worth something like $100 billion, and projections show it doubling to $200 billion by 2032.
Wow.
So all these new hospitals and clinics need a lot of people to run them.
So we need more of everyone then, right? More doctors, nurses, all of that.
Absolutely.
Mm-hmm.
Across the board, you've got a growing demand for medical doctors, nurse practitioners, medical technicians, everybody.
Uh-huh.
Specialized nurses are really key, particularly for primary health care, especially in rural areas. The NSDC report actually highlights this as a really urgent need.
And it's so interesting how global events can really shift priorities, right? Like after the pandemic, I remember reading something about how epidemiologists are way more important now.
Totally.
Yeah.
Their role has become absolutely critical. With COVID-19 and everything, their expertise in understanding disease patterns, like how they spread and what causes them, has become vital for protecting public health.
Okay, so that's the demand side. We've got this massive and growing need for healthcare professionals. But the problem is there aren't enough people to fill those roles. So what happens when you have this mismatch? What does that actually mean for patients? Like me, if I go to a hospital,
Yeah, that's the real question, right?
what are the consequences of this shortage?
The consequences are really big, and they definitely impact the kind of care that you receive.
Okay.
First off, the existing staff gets overworked. When you don't have enough people in hospitals and clinics, the nurses, doctors, all the other staff, they have to take on way more responsibility. They end up working longer hours. And when people are stretched too thin, they might not have the time to give patients the attention, the monitoring, the kind of care that they really need.
Yeah.
And as you can imagine, this leads to a lot of dissatisfaction and burnout among the healthcare staff, which we're going to talk about more later on.
Yeah, it's like a domino effect. Not enough staff, everyone gets overworked, the quality of care suffers, people get burnt out, and it just keeps spiraling. So let's dig into the reasons behind this shortage. You mentioned that BMC Public Health Review. They did a pretty deep analysis, right?
They did, yeah. They looked at tons of research on this. And they found 5 main things that contribute to this whole HRH shortage, which stands for Human Resources for Health in India.
Okay.
So the first major issue they found was inadequate production and recruitment.
So basically, we're not training enough people to become healthcare professionals, and even if we are, we're not getting them into the system effectively.
This in a nutshell, yeah.
Okay, so what are the specifics there? What are the things that are making this such a challenge?
Well, for starters, India has a massive population, which puts a huge strain on healthcare, right? You need a ton of healthcare workers just to begin with. And then you have this really uneven distribution of professionals between urban and rural areas. The example they gave for Madhya Pradesh was really striking. 120 doctors per 100,000 people in urban areas compared to only 12 in rural areas.
Wow, that's a huge difference.
It is. It means that a lot of people are left with very limited access to healthcare. And then there's the aging population. As more people live longer, the demand for healthcare services goes up, especially for geriatric care.
Yeah.
And then there's this whole other layer. India is a major destination for medical tourism, so you've got healthcare professionals who are taking care of international patients as well, which further stretches resources.
Right, so all these people are coming from other countries to get treatment.
Exactly. And on top of that, there aren't enough postgraduate seats in medical courses.
Yeah.
That limits the number of specialists who are being trained.
So it's like a bottleneck.
Exactly. And then the final thing is that there isn't a centralized HRH database. That makes it really difficult to plan effectively and deploy the existing workforce.
Oh, yeah. It's hard to solve a problem if you don't know where everyone is or what their skills are. So we talked about the urban-rural divide, which is a problem in so many areas in India, and it sounds like it's especially bad when it comes to healthcare.
It really is, yeah.
What was the second reason for this shortage, according to that BMC Public Health Review?
Well, a big one is job dissatisfaction. Loads of studies pointed to this as a major reason why there's this ongoing shortage.
Okay, so what exactly is making healthcare professionals unhappy in India?
It's a few things, really. A lot of them are working in places that don't have enough resources. They don't have the right equipment. The infrastructure is subpar, and that leads to a lot of frustration and burnout. And then there's the issue of pay. A lot of healthcare professionals, especially those in the public sector, are just not paid enough.
Right.
And if you don't feel valued and you're not being compensated fairly, it's hard to stay motivated, right? And on top of that, a lot of them feel like there aren't enough opportunities for them to grow professionally or advance their careers. They feel stuck.
So it's not just about bringing more people into the system. It's about making sure the people already there want to stay.
Exactly, yeah.
Okay, so we have inadequate training and recruitment, people leaving because they're unhappy. What was the third reason for the shortage?
It's what's often called brain drain. Basically, a lot of highly skilled and educated healthcare professionals are leaving India to go work in other countries.
Right, that makes sense. Lots of countries struggle with that. What are the reasons behind it in India specifically?
The review highlighted better job prospects as the main reason. Many people feel like they can get better paying jobs, they'll be in a more supportive environment, and they'll have a better quality of life overall in other countries.
Okay.
And sometimes people feel like there aren't enough jobs in their specific field within India. So if they can't find the right position here that matches their skills and ambitions, they look elsewhere. And there's also the draw of better educational opportunities and specialized training programs abroad.
Right.
People might go abroad to study, and then they decide to stay there after they've finished because they see better career paths.
That's a loss for India, though, isn't it? Investing in training these professionals only to see them leave and contribute to another country's healthcare system?
It is, yeah. It's a significant loss of valuable talent and resources.
What was that fourth factor that's making this shortage worse?
The fourth theme they identified was regulatory concerns. It's not just about staffing regulations, it's a lot deeper than that.
Okay.
Sometimes essential benefits like wages and pensions are delayed, and that creates this sense of job insecurity. Like people don't know what to expect.
Yeah, that makes sense.
And then there are unequal opportunities when it comes to things like job stability and access to benefits. And sometimes prior work experience isn't even acknowledged.
Huh, that seems unfair.
It is. And then you have the recruitment rules themselves, which are often super complex and all over the place.
Oh, so just the process of getting hired is super complicated and confusing.
Yeah, exactly. And those recruitment processes themselves are often slow and really unpredictable.
Okay, so we've got bureaucratic hurdles, discouraging people from entering the field, on top of everything else. What was the fifth reason, the last one?
The last one was the lack of training, monitoring, and evaluation. And I'm not just talking about the initial medical education here.
Right.
It's about what happens afterward, the ongoing professional development.
Okay.
Sometimes that initial training just isn't enough. It doesn't give people all the necessary skills and knowledge.
Got it.
And then there aren't always good systems in place for monitoring and evaluating how people are doing, how they're performing. And that makes it really hard to pinpoint where someone might need extra support or additional training. And the review pointed out that sometimes there's a mismatch between the expertise of the healthcare professionals and what the population actually needs. That gap can get even wider if there isn't proper continuous training and evaluation.
So it's really this whole tangled web of interconnected problems. We're not training enough people in the right specialties. People are leaving because of bad working conditions and low pay. And then we've got bureaucratic red tape and not enough ongoing training to support the people who do stay.
It's a lot, yeah. It's a really big challenge.
But it's not hopeless, right? There are some things being done, some solutions being explored. What are some of the ways forward that you found in our sources?
Yeah, definitely. The NSDC report mentioned a few things. They talked about upskilling programs.
Upskilling.
Yeah, it means basically giving people who are already working the opportunity to develop new skills and enhance the ones they already have.
Oh, okay.
Some healthcare facilities are already doing that. And they're also trying to use technology to make recruitment more efficient and potentially increase the overall workforce capacity.
Makes sense.
And they really stressed the importance of having good financial incentives, professional development programs, and mentorship opportunities. Those are all ways to attract and keep talented people in the healthcare system.
Yeah, so making it a more attractive career path, basically. And the BMC Public Health Review, what did they say about potential solutions? They took such a deep dive into all the problems.
They did. They really emphasized how important it is to have a better system for recruitment and to tackle job insecurity.
Right.
They pointed out that recruitment can be really slow and unpredictable, and that makes it hard to attract people.
Yeah.
And then there's the job insecurity part, the whole uncertainty about salary, pensions, and recognition. That really drives people away.
Makes sense. Nobody wants to feel like they're on shaky ground. Okay, so streamlining those bureaucratic processes and making sure people feel secure in their jobs, those are key steps. And we also have those websites we looked at from NABH and Supreme Medic Consultancy. What did they have to say about this?
Yeah, so NABH, the National Accreditation Board for Hospitals and Healthcare Providers, their whole thing is about setting quality standards for hospitals and healthcare organizations. So by creating these benchmarks and making sure hospitals meet them, they're indirectly improving the work environment, which can make staff happier and hopefully encourage them to stay.
Okay.
And then Supreme Medic Consultancy, they're more hands-on. They help hospitals with a bunch of things, including actually finding qualified doctors and nurses to hire.
So they're like recruiters.
Kinda, yeah. And they also help hospitals navigate that whole NABH accreditation process.
It's interesting that there are even companies like Supreme Medic, It shows just how big the staffing problem is in India, that there's a whole market for these kinds of services.
Yeah, totally. It shows that hospitals need help with this. It's not something they can always handle on their own.
Another thing I've heard people talk about is task shifting. I'm not really sure what that means, though. Is that a potential solution, too?
Yeah, it could be. It's about being smart about how you use your workforce.
Okay.
So instead of having doctors do absolutely everything, you train other healthcare workers, like nurses or community health workers, to do some of those tasks.
So like things that don't absolutely require a doctor's expertise.
Exactly. For example, you could train nurses to handle routine checkups or manage some chronic conditions, things like that.
Hmm.
Or they could do some basic screenings, things that doctors usually do, but don't necessarily need to.
Yeah, that makes sense. So basically, you're making the most of everyone's skills.
Yeah, and that frees up doctors to focus on the really complex cases.
And that's probably better for everyone, right?
Right.
Patients get more personalized care, and doctors don't get completely burned out. But I guess that would require extra training, right, for the nurses and everyone else.
It would. It'd be a big investment, but it could be a really effective solution.
We also talked about the difference between permanent and temporary staff. Is one better than the other when you've got these staff shortages?
Well, but both have their pros and cons, right?
Right.
With permanent staff, you have stability. They get to know the facility, the patients, the whole system. But they can be more expensive because of benefits and all that. And they're not as flexible. If
Yeah.
you suddenly have a lot more patients or someone gets sick and you need to fill their spot quickly.
Oh.
Temporary staff can give you that flexibility. You can bring them in when you need them,
Yeah.
and they could be more cost-effective in the short term. But the problem is that you lose that consistency in care.
Right. Patients might see a different nurse or doctor every time they come in.
Yeah, exactly. And the temporary staff might not feel as committed to the hospital or clinic.
It's more of a transactional thing.
Exactly.
Hmm.
And then you've got the whole hassle of constantly having to find new people and train them.
So what's the best approach then?
Well, a lot of people think a hybrid system might be the best way to go.
Hybrid meaning?
You have a core group of permanent staff who provide that stability, and then you bring in temporary staff when you need extra help.
Oh, okay. So it's like the best of both worlds.
Yeah, that's the idea. You get the stability and the flexibility.
Yeah. And another thing we kept seeing in the sources was how important continuous education is. Like what healthcare professionals learn after they've finished their initial training. How does that fit into all of this?
That's super important. Healthcare is constantly evolving.
Yeah.
New technologies, new treatments, new best practices. It's always changing.
Right.
So if you want to give patients the best possible care, you have to keep learning. You have to stay up to date.
Okay, but isn't that hard? Like if you're a busy doctor or nurse, how do you find the time to keep learning new things?
That's where things like online learning come in.
Oh, right.
E-learning is great because you can do it at your own pace, in your own time.
Makes it a lot easier to fit into a busy schedule.
Yeah, exactly.
Like
Makes continuous learning more doable.
And we also read about how important that initial medical training is. Like that's the foundation for everything, right?
Absolutely. Having really solid initial training for doctors, nurses, medical assistants, it's the bedrock of a good healthcare system.
Yeah.
It makes sure that everyone has a baseline level of competence, that they have those core skills and knowledge, and it helps them adapt to new technologies. Like healthcare is getting more and more high tech all the time.
Yeah.
And we have an aging population, which means healthcare professionals need to know how to meet their specific needs.
Makes sense.
And then there's telemedicine, which is becoming more and more important, especially for reaching people in remote areas.
Right.
So initial training needs to cover all of that now. It's not just about the basics anymore.
So it's about having a really solid foundation from the beginning and then having support for continued learning throughout your career. And that brings us to the last thing we looked at, how nurse staffing levels affect patients.
Right.
What did that research show?
The review is super clear about this. Having enough nurses makes a huge difference.
In a good way, I hope.
Yeah, definitely. When there are enough nurses, patients are less likely to die. They're less likely to have complications or accidents like medication errors or falls. And overall, the quality of care is better.
Okay, that makes sense. More hands on deck, more attention for each patient.
Exactly. And the opposite is true too. When there aren't enough nurses, you see the opposite effects. More patients die, there are more problems, and nurses get burnt out, which makes them more likely to leave.
Yeah.
And the review highlighted something really important. It's not just about throwing more nurses at the problem.
Right.
You have to create a supportive work environment where nurses feel valued and respected. You need good leadership within the nursing teams, and everyone has to work together. Doctors, nurses, everyone.
So it's about having a healthy work environment for everyone.
Absolutely.
That's really interesting. It's like a reminder that nurses are the backbone of the healthcare system.
They really are.
So, to sum it all up, India is dealing with a pretty serious shortage of healthcare staff. And it's not just one thing causing it. It's this combination of factors. Not enough training, people leaving because of bad working conditions and better opportunities elsewhere, bureaucratic hurdles, and not enough opportunities for ongoing learning.
Exactly. It's a complex problem.
And all of this affects both the healthcare professionals themselves, who are under so much pressure, and the patients who rely on them for care.
Yeah, it's a problem that touches everyone.
So now that you've heard all this, I want you to think about something. Given how interconnected all these issues are, what do you think is the most important area to focus on? Where should we be putting our resources and energy if we want to make a real difference in India's healthcare system? Think about it. Maybe dig into some of these sources we talked about and do some more research on your own. This is an issue that deserves our attention.
Absolutely.
That's all for today's deep dive. Thanks for listening.
Thanks, everyone.